Hi, everyone. Thanks for joining us at the Digital Media Zone at the United Nations. My name is Melissa June Rowley. I'm the co-founder of the Toolbox.org, and joining me is Kasia Melanovska.
Good morning.
Good morning, and she is the director of the Global Drug Policy Program. And you're here to talk about the way drug policy is impacting women, and we'll also discuss the role of civil society in the UNGAS and the Global South.
Yes.
Would you like to start with women?
Sure. So the point that we are trying to make here at UNGAS, but also more broadly, as a private foundation, it's called Open Society Foundations, is that the current drug policy, the current drug regime, is very much an engine for social injustice. And so what does that really mean? If you look at people who are economically disadvantaged, whether they're poor farmers in Bolivia or whether they are poor kids that grew up right here in the Bronx, when you look at the race issues, again, when you look at Afro-Colombians in Colombia or people or refugees in Italy, all of those sort of injustices come together to create a perfect storm of very troubled outcomes, where people get put in prison, where people are denied the right to vote because they were in prison, where children are being taken away from mothers who have committed what is considered drug crimes, where kids end up on the streets because their parents got incarcerated. So all of that creates a very sort of intense, perfect storm. And so within that, women actually have a very special place. And doesn't come as a surprise to anyone, because in fact, sort of single moms, very often very economically disadvantaged, are already struggling and already have very few options. So if you look at many Latin American countries, there is really a huge push to empty prisons, recognizing that incarceration is not always a solution to the drug problem, so it's not an appropriate solution. But when you look at incarceration of women, in fact, those numbers are going up dramatically. There's some countries in Latin America where 70% of women in prison are there for what is called drug-related offenses. And so when all of us watch television, read newspapers, and hear about drug traffickers and hear about seizures of 1 ton of coca coming out of Colombia, none of us imagine that women are the quote-unquote perpetrators. And they're not, but they are the ones that get locked up. And often it's because they're so insignificant to the drug traffic industry that there isn't anyone who is going to pay their bail. There isn't anyone who is going to try to get them out of prison. They very often are on their own. So this criminal justice system basically sort of compounds a set of very complicated and dramatic situations that women find themselves in.
And your foundation, the Global Drug Policy Program, is working with organizations, helping fund organizations that are working on legislation to combat this, or what are the organizations doing specifically?
So we actually have the privilege of working with groups across the globe, and some of them are very reputable research outfits in Washington or in other capitals. And what they are doing is collecting data and then making set of policy recommendations to government officials. But then there are also academics at universities that are collecting data and also are trying to distill information from that data that will help us think through how to respond to the problem. And then there are advocacy groups. There are advocacy groups from Japan to Bolivia, really across the world, that are trying to make a case for new, more thoughtful, less punitive response to drug policy. And some of the discussion right here at UNGAS is precisely that. How do we use the tools that are already in existence, whether they're public health tools, whether they are a human rights tool, to appropriately respond to a problem which has mostly been really considered a criminal justice problem.
And when you mentioned earlier the drug-related offenses that these women are imprisoned for. This covers everything from smuggling to drug use to what are the main areas that women are getting incarcerated for?
Well, so you know, if you are a if you are a mother, and if you're a drug user, I mean, just imagine the stigma associated with it. Just imagine the sort of image that we have of motherhood, whether it's in the United States or whether it's in Europe or in Asia or in Latin America. I mean, it's so. The image of a woman drug user who is also a parent is just so incredibly demonized. And this creates multiple problems, because that means that if you are a drug-using mom, you're not going to come forward for services, because why would you self-identify yourself as a drug user if you run a risk of your children being taken away? So we are creating this really very sort of vicious cycle where women are in trouble, they need help, but they will not come for help because they fear that their motherhood is at stake. Drug possession for those who are drug using. And then, you know, I've as I traveled the world and seen some of those examples, let me just give you one from Tajikistan many years ago. As Soviet Union was falling apart and as Tajikistan became an independent country, basically men, fathers, brothers left for Russia. They became migrant workers in Russia, and women were left alone with the kids in small villages in high Kyrgyz mountains. So drug sort of industry came in very quickly. And so I was talking to a minister of interior in Tajikistan, who with great pride was explaining to me that they just opened up a new colony. That's what they call it, colony, sort of an outdoorsy prison for women, exclusively for women. And he was telling me this as though that's a great achievement. So there was not a discussion of what could have been done to support those women. And then when you have a conversation with him, and I said, so, you know, what are the quantities that people are being incarcerated for? And they're tiny quantities. You know, we're not talking about 100 kilos. We're talking about, you know, 1/3 of a kilo maybe that is being smuggled. And then, so the question was, so what do they spend that money on, right? And the answer was on shoes for their children or on books for their children. And so this conversation about, so isn't that an illogical policy response to put those women to prison? But, you know, it's just a very different measure.
Yeah. So what can members of state, what can the UN bodies do? What can the UNGAS do to start addressing the situation in a different way?
Well, again, we have a set of principles that the UN offers. One of them, obviously, is the Declaration on Human Rights. And there are many experiences that have now been documented across the world about how to respond to drug-related problems in a smart, thoughtful way. Mm-hmm. And so they may include diversion so the police, instead of putting people into lockup, in fact, takes them to social services, expanding social services for people who need it, and not only public health in terms of treatment, but also economic services where people are trained for jobs, where mm-hmm. there are different opportunities that are offered to them.
We only have about a minute before the Q&A starts, so I really want to get to the civil society question, sure. because I know you'd like to discuss what the role of civil society in the UNGAS and the Global South.
So many of us who work in the drugs world actually came to the drugs world from the AIDS world, where we actually had an opportunity to articulate a very global agenda and get the governments and the UN to buy in and actually offer treatment for people who were in need. So for me, it's actually very, very clear that it is the civil society that needs to articulate the problem, state it very clearly, make that information available to the government so the governments can bring it to the UN. And so I'm really pleased to see here right now for UNGAS so many people who, from really across the world, from coca growers in Colombia to very reputable think tanks here engaging with the governments, because I think that's really the key.
Okay.
Thank you.
Great, thank you so much. I wish we had longer to just do this, but we're going to open it up to the audience for questions now. Does anybody have any questions? I'll hand my mic over to you if you do.
I'm very sorry. Forgive my ignorance. It's a very basic question. What is harm reduction in a nutshell?
So basically, harm reduction is an approach which you know, the way people think about it is meeting your client where your client is. So if it's a drug user who actually is injecting heroin, what can we do to make sure that the costs of that drug use are as minimal as possible on that person and on a society as a whole? So we may be offering needle exchange, we may be offering methadone maintenance as treatment, we may be offering overdose prevention. So rather than pushing people in the direction that we think they should go in, abstinence, we basically meet them where they're at. And it's a very useful approach, because that's an approach that actually engages and makes people want your services. I think what we often see with abstinence treatment is that even though we have the service available, no one wants to take it up. So it becomes somewhat useless, frankly speaking. So providing those services that are really the priority for the user is what harm reduction is about.
I have one more question. Do you know the percentage of women incarcerated for drug-related crimes versus men?
Yeah, it really depends. It really depends. But in a number of Latin American countries, the percentage is as high as 70%. And more dramatically, in countries where people are executed for drug-related offenses, and that is, for example, in Iran, again, so I think close to 70% of executions are executions of young women. So that is obviously a dramatic bit of info. If I'm allowed to just invite people to a space that we have outside of the UN on the corner of 47th Street and Park Avenue today and tomorrow, parallel to Angas, that's when discussion about many of those injustices are happening. Beautiful artwork, which actually is showing those lost to the war on drugs, those that have been imprisoned. So I think if anyone is interested in sort of leaving the UN space and engaging with art and culture, it'd be great if you joined us.
And where can people go online to find more information about your foundation?
So we are called Open Society Foundations. If you Google that, there's a lot, and there are two programs that focus on it, which on drugs, which is the Global Drug Policy Program and the Harm Reduction Program of OSF.
Okay. All right. Thank you so much.
Thank you.
Okay.